right, welcome everybody. Thank you so much for being here today to our bi-monthly Connecting the Dots networking meeting. My name is Kara Kaikini. I use she, her pronouns. I'm the executive director of the Maine State Breastfeeding Coalition, and I'm really happy to be here today. So I'm going to drop in the chat again our agenda for the day and our notes for the meeting, not the full day. We're only here for an hour today. So thanks for being here. And um, we will spend this hour with me starting out with a few minutes of an update and going over all of these wonderful notes that we have in our New Knowledge Worth Having document. And then we'll spend the rest of the meeting going around and doing introductions and sharing any updates that you have. There might be some legislative updates you have. There might be a program update you have. There might be a need that you have or a question you have that other people in this group could help you with. And we just want to keep this as open as possible for people to share and connect. And then if we have a few minutes, we can wrap up and share anything that's coming up that folks might want to know about. Um, so feel free to have cameras off now, that's fine. But I definitely hope that cameras can come on later when we are doing introductions and sharing any updates and questions. It's really nice to feel like we're all in this room together. So thanks for being here. First, always want to remind you that we have several committees that's part of the Maine State Breastfeeding Coalition um, that are regularly meeting and working on the activities that we call ours. We have an advocacy committee, an events and fundraising committee, workplace, diversity, equity, inclusion, justice and belonging committee, communications committee, professional development committee, and conference planning committee. And if you're interested in volunteering with the MSBC, we could use your help with any of those committees or any other tasks that come up, like reviewing our website and making sure that the content is up to date, that sort of thing. So there's a link here in this document where you can click to sign up to volunteer. You can also just email me anytime at director@mainebreastfeeds.org. And if you're interested in supporting us financially, we are always open to donations. We could always use them. And you can do that through our website. You can also do a Facebook fundraiser. And there are lots of ways you can be supporting us, either with time or money. So thank you so much. And thank you to our annual partners who are also making our advocate level partners in particular, who are really making sure that we can get this work done every day. Um, some updates for you. We have a few new blog posts thanks to Robin Snyder Drummond, who is on here, and she might want to mention this later as well. But we encourage you to take a look at our blog, mainebreastfeeds.org/blog. And then a sneak peek that you have here is that we are almost done with our strategic plan. We have a board meeting next week where we plan to finalize and put that final stamp, which of course, a final stamp on a strategic plan only means that this is a final copy right now. Strategic plans can change, and we've been encouraged by our consultant to be open to that if that comes up. It's really easy to want to have 100% pure excellence in a strategic plan, but trusting and knowing that change can be good as well. So I just wanted to share today our goals in our strategic plan. The first one is to expand equitable access to lactation support. Our second is to advance provider capacity to meet diverse lactation needs. Our third is to foster communities of support for breast and chest feeding. And our fourth is one of the more important ones, but to strengthen capacity of the organization to realize our vision, to make sure that we can do all of this work. We are also going to be sharing this all and our objectives. We'll go into specifics a bit more at our conference that we hope that you can all attend on September 17th. I'll share a little bit more. I'll go more in depth, and we will also roll out our new mission and vision. We are nearly done with that as well. If you've ever been a part of that process, you know that can be really tricky, but really rewarding too. So we're excited to have this new mission, vision, and strategic plan going forward and to share it all with you. So it's a sneak peek for now. Also wanted to share our next webinar is coming up on October 2nd. I can't believe this is less than a month away. We did submit for continuing education for nurses, um, and we hope to hear soon about that. And as a result, our pricing might change for the webinar, where right now we ask that folks are donating what they can. That can be $1, it can be $20. We haven't had a set price. We might be adding an optional set price, and we might, just to make things more fun, once we do have continuing education available, we will have a set price. And I'm really curious, actually, let's take advantage of this group here. If you can take a moment and share in the chat, either directly to me or to everyone, based on the webinars that you've attended through the Maine State Breastfeeding Coalition, what is a price that you would be willing to pay if we have a fee every webinar? Would you be willing to pay nothing? Would you be willing to pay $5, $20, $30? What is a price that you feel is reasonable for our webinars? And that will be helpful for us when we're considering the price that we set. We also record our webinars and make them available on our YouTube page, so know that that is always an option as well. And for now, we don't see that option changing. So we hope that you consider signing up for this webinar. Oh, that's not what I wanted to do. And I will put that link right in the chat for you. Okay. And again, if you haven't already heard, and hopefully you've heard because we've been spreading it pretty far and wide through our newsletter and social media, we have our conference coming up September 17th at the Augusta Civic Center. We are trying to make the pricing as reasonable as possible for you all by offering lots of different special codes so that we can have as many people there as possible. Right now, we have right around 100 people who will be there, and we're really excited about that and hope to have even more. We have space. So take advantage of that promo code COLAB to get 25% off our extended early bird rate. Hopefully that makes it possible for you and any others to attend. And if you have any students in your life who would be available that day, college students in particular, what I'm thinking, nursing students, that is $25 to attend our conference. So please spread the word. We're really looking forward to it. I think we have some pretty great speakers lined up with some topics that will hopefully meet most people's needs. I know it's not easy to find topics that will meet everyone's needs, but we do the best we can. And we just want to thank our exhibitors who and our sponsors very much. I'm going to continue to move on here and know that we always have our LGBTQIA2S plus resource available for folks. Zip Milk too. If you aren't already listed on our Zip Milk directory, please do. We want to make sure this is as populated as possible for parents to know where the support groups are, who their WIC breastfeeding coordinators are, breastfeeding counselors and IBCLCs, etc. Please make sure that you have submitted your listing. Chat too. Let's see what else. We have the same parent resources listed here as we have in the past, and you can go to our website anytime. As far as legislative updates that I want to share, I did notice Katie Reed. I believe I saw Katie Reed join us. Maybe not. Yes, I see her. So Katie, maybe later you can give more of an update, but I did want to share that there is a Maine Department of Labor Paid Leave Authority meeting and public comment session coming up next Tuesday at 9 o'clock. This is an opportunity, as Katie will share more of, to make it clear that there's no need for new legislation because the cloture date for submitting any new bill ideas is coming up, and they want to make sure that that they have heard everyone's comments and know whether or not they need to make any other changes to the law. The Paid Leave Coalition believes there's no need for new legislation, and let's just let it work, let it happen, let's get it going. It's supposed to start next spring. So if you have any comments about that, or if you're interested, I heard in the meeting yesterday that this is a great starter public comment opportunity. It's very low pressure. You can do it by Zoom or you can go there in person in Augusta. And I'll let Katie share more when she introduces herself later. But there's more paid leave resources available too. There's an updated FAQ for employees. There is also an FAQ for employers. So that information is all here in this document. Then I also just got this email from ASTHO, which is the Association of State and Technical or Territorial Health Officials, federal government program essentially. And they listed out what the House Appropriations Committee has suggested for funding. And I'm not going to go through all of this now, but you can see this is specific to public health. You might be interested in what is being proposed. Quite a few decreases in areas that you might be interested in. So again, just going to scroll through this here. And if you want to read the actual link, I will put that in here as well. And also have contact information for our US Congress folks. And since this is a House of Representatives recommendation, you would be contacting either your, Representative Golden or Representative Pingree, depending on who your rep is. It doesn't hurt to contact them both as well if you have any concerns. A reminder, everything that is recorded for our webinars and our meetings are on our YouTube page. We also have our Patchwork of Parenthood storytelling event from May. That was recorded and that is available on our YouTube page as well. So if you haven't watched that yet, it can be a really lovely experience. Our workplace resources are available too. We're excited to have 2 more workplaces to recognize in the near future once we've gone through that process. So stay tuned for that. Really excited about that. If you and your workplace have any job opportunities available, know that you can share those here in this meeting or with me, and I can put that in an email if I find that's appropriate to the coalition. And then last, I believe, is our pattern for coalition meetings will continue in 2026, except for January and July when they fall on or near a holiday. So stay tuned. We'll be sending out more information with those. And I'm curious if you already have a calendar invite, if you have an invite on your calendar already, or if you would like one, that would be great to have you jot down in the chat box as well, either just to me or to everyone. Do you have a calendar invite for these meetings? Do you not? Would you like one? That's the plan, is to do that again. And I'm just always curious to know if it's working. Okay, so that is it for me. We're at 12:18. We've got 42 minutes left to go. And I want to hear from you. These are the questions that you can consider when it comes to sharing in this next part of the meeting. So I'm going to stop sharing my screen. And yeah, so this is the part of the meeting where, let's see, how many folks do we have? Our group isn't giant today. It's a really nice group. And we have quite a few note takers as part of this group. So maybe what we can do is actually go through the participant list and I will call on folks. Sometimes we do this, sometimes we don't. But I think this is something we could probably make happen today. But actually, to start with, how about if you have something that you want to update, and especially if you know that if you have to pop off early, then please raise your hand or go on camera and we'll give you an opportunity to share an update. And this is a great time if everyone could come on camera. That'd be really nice. I know that some folks might be eating or you might be doing other things, but it's really nice to see faces. Hi, everyone. All right, if you have something you would like to share or update, Katie, I'm going to call on you first since I see you and I already kind of mentioned your name earlier.
Yeah, thank you, Kara. Hi, everyone. I'm Katie Reed. I use she, her pronouns, and I work at the Maine Women's Lobby. And we also convened the Paid Leave Coalition, which the Breastfeeding Coalition is a very active member of. So we are really grateful to you all. On the So on Tuesday next week from 9 a.m. on, there's no end time because it is for public comment and they don't want to stop people from providing comments. The Paid Leave Authority, which is the oversight body for the paid leave program, is soliciting public comment and feedback on the program so far. And so if anyone has experience with the current paid leave program, either as like an administrator or business owner, and wants to be able to share your insight, or with the folks that you work for, acknowledging how um, if the benefits were already in place, the folks you work with would have access to time off, which could be helpful for them, especially in welcoming a new child into their home. That would be wonderful. Thank you, Kara, for putting the guide in the chat. Feel free to use that guide to think about what you'd want to say. This is The benefits are not live yet. They will go live in May of 2026, and that is what our goal is to get a balance of feedback that is positive so that the authority isn't only hearing from folks saying, oh, well, the administration is a little bit difficult, possibly, if that's what some businesses feel, but also hearing how important paid leave is and that we want to keep the timeline going so that people can get it May 2026 and we don't risk pushing that deadline back. So that is sort of where we're at right now with that meeting. It is less formal than public hearing. So if you've ever testified at a public hearing, you have to write up your testimony. It has a very structured way of how you address the committee. And then you submit that. You have to submit written testimony either by bringing copies in person or submitting them online. This, it's a little more informal. It's their regular paid leave authority meeting. They will just call on you, kind of say your name, and then you would go up. It's also on Zoom. So once the people go in person, you can keep it on Zoom in the background. And then when they're like anybody else, you just hit the raise hand function and they call on you and have you go. And they do time it. So you do have about 3 minutes to share the information that you have. It can be under 3 minutes. So even if it's like I'm paying into the program. It is so meaningful to me to have this. And I know the people I work with are really looking forward to having this in May of 2026. Even something as simple as that can be shared. And then you say, thank you for your time. And if they have a clarifying question, they may ask that. But other than that, it's really just done. It is not, I will share, it is not a time to ask questions of the authority. So if you have technical questions about paid family medical leave, this is not the venue to like ask those pieces. There is a call center that they have, and also the Paid Leave Coalition can be helpful in answering or connecting you with folks who have the answers to some paid leave questions. So I would just clarify that for this venue.
Awesome.
Yeah.
Thank you, Katie. Does anyone have any questions for Katie about paid leave law or about this meeting coming up? Okay. Thanks, Katie. And I put the public comment guide in there. I'm sure contact information is in that guide, but if you mind putting your contact info in the chat, Katie, for anyone who might not have it. Thank you. All right, Nikki, I see you're here, and we had talked about you coming to share an update and information. So would you like to go next?
Yes, I was about to raise my hand. Thank you for having me. My name is Nikki Williams. I'm a workforce consultant with the Children's Oral Health Network, and I've been working with them for a couple years on a project that has been really focused on expanding dental providers and people who work in the kind of dental services field throughout the state, so that there can be more access for families and children in particular. And we've been doing a lot of different initiatives, including working on expanding the school oral health program and working more with independent practice dental hygienists. But I wanted to come today because we have, and I had reached out to Kara about this, we have this free self-paced online learning series that we call the Oral Health Navigation Learning Series. And I'll put the website in the chat. It's free, it's self-paced. It is structured as a micro-credential. And the idea is to really support people who work with families, caregivers, children, in a variety of settings, and you don't have to be a dental provider, but you might just be working with a family or or working where there's kids, and someone's complaining of mouth pain. This learning series is really designed to help practitioners, and in community-based settings mostly, but in any kind of setting, have more knowledge about oral health, so that you can support families to navigate the oral health system and try to get access to care. It's incredibly hard to get access to care for a whole variety of reasons, one of them being that there aren't enough people working in the field in community-based settings. So this training series was developed to really kind of demystify, bring foundational knowledge and skills into lots of different settings with people who might be a childcare provider, might be a community health worker, might be working with families in a lot of different ways. And this just gives you some additional tools and knowledge and information, so that you as a provider or a person who was working with families can just have more knowledge for yourself. We actually think this learning series is really helpful for anyone who has teeth. And so we just really want to kind of spread the word. The learning series is free right now, because we have some funding from the state, which is sunsetting at the end of this year. But our intention is really to make this, if anything, free, ongoing, but hopefully low cost into the future. But like for the next few months, it's all online, and it's really 8 modules, but we kind of estimate that it would take anyone maybe like 6 to 8 hours, depending on your English proficiency, and access to the internet, laptop, and all of that. But like we think it would take approximately 6 to 8 hours to finish the whole thing. And you might decide as you're looking through it, if you're interested in it or working with someone else who might be interested in it, that you want to take certain modules and not all of them. It's really designed to be sort of customized to the individual person and their learning needs. And it is in a framework of a micro-credential, which we partnered with University of Maine System on. So there are levels of kind of skill building that are built into the learning series. And so that is something that could be eligible, that would be available to people if they're interested in it, but it's totally optional if anyone wanted to pursue it as a micro-credential. But I'll also, Kara, I think I sent you this kind of overview document previously, but I'd be happy to share that in another format. It just goes into more depth about the learning series, the kind of brief overview of the different modules and how it aligns with the micro-credential framework. But really, the most important thing is if anyone's interested in this, they can go to that website and then click on create account. And then you just can create a free account, and then you can just explore in the dashboard what all the modules are, and kind of move through it as anyone would be interested in. So yeah, I'm happy to take questions, or that's it.
Yeah. Yeah, it sounds like really, really great information for folks to have. And that it seems like there's always new research coming out about oral health and the impact on the full body, and why it's so important for new parents to understand that for their babies too.
Yeah,
It's a great topic.
absolutely.
Thank you.
Thank you.
Brittany, yes, I was going to call on you next. Thanks for hanging in there.
Of course. No, of course. Thanks for having me. Brittany Regan Fisher. I'm technically here from 2 different places, Acceleron, which is the DME, and then also MBC, so the Mass Breastfeeding Coalition, as the National Director of Zip Milk, which is a program of MBC. So I wanted to start with Zit Milk. I put in the chat that I am attending the conference on my own accord just because I'm so excited to go. But I also will be there. I'll have my laptop at the ready. So if anybody does have questions about Zit Milk or their listing or anything in general, I'll be there and, willing to hang during lunch or breaks or anything if anybody needs it. And then also for the Acceleron side, as a DME, one of the exciting things, I don't know if everybody has heard, but for breast pumps and replacement parts, we all know that one of the most common part to be replaced is that valve or the duckbill valve. And there previously was not a billing code for that. But there is now a code that was submitted to CMS and it was approved. I think it's A4288. I could be wrong, so don't quote me. So it is approved. It will technically go live in October, but the next step is making sure insurances actually get it on their fee schedules. So that's something that my boss here at Acceleron is really passionate about, is making sure insurances are actually active and working with new codes and getting them on the fee schedules and at appropriate reimbursement rates. Duckbill valves tend to be like $10 or so for a set of two, so they're not a pricey item, but that doesn't mean that insurances are still going to give a good reimbursement for them. But so just wanted to announce that, and if anybody has any ins with any insurances or anything, get the word out there. The more that we can put pressure on them, make sure they add it and let families advocate for themselves and providers, the faster they'll start getting included and covered, and one less thing for families to have to pay out of pocket for. And outside of that, I just wanted to also shout out that Massachusetts is also having our annual conference at the end of the month. And so, it was just another thing to share. So if anybody has questions about that, they can reach out to me. But that was my fast-paced thing, so I can get back on the road.
Awesome. Thanks, Brittany. I don't know if
Thanks.
you saw my email to you earlier or not, but
I did,
okay.
yes.
Sorry
Yeah,
for
I'm clear.
the
I'm
last
checking my schedule, and then if not, I'll send you some slides tonight.
Okay, cool. Thank you. All right. What else?
I have a quick update. Actually, just letting folks know about a survey we're going to send out. So hi, I'm Meg from the Maine Doula Coalition. My pronouns are she, her. The Doula Coalition received a peer meetings support grant recently from MIHAF. And so Doula Leah Kolstrom will be hosting these 60 to 90-minute meetings primarily for doulas as a means of sharing some lived experience to go through topics of concern, things that they're bumping into. Every kind of topic under the sun will be open for discussion. And so we're really cognizant of that this is peer led. And so we'll be sharing this survey to ask some logistical questions like when and where, when is the best time, but what topics are folks really bumping into? And so we'll be sharing that. We have a newsletter coming out next week or early this week, I think. And look for the survey. So any doulas in your vicinity, sharing that would be lovely, because we really want to hear what are their pain points, what are their wins, what are their challenges, concerns that they're seeing here in Maine.
Awesome. Thanks, Meg. And if you have any other resources that you want to put in the chat, Meg, for Maine Doula Coalition, that'd be great.
Sure. We have a brand new website, like any day now. I'm launching it, and it will be loaded with resources and just updates in general. So I'll share the old website, but the new one will be launched hopefully this weekend.
Okay. Cool. What else? I'm going to drop a link to our conference in the chat. And I also got a message from Melinda Corey from Help Me Grow, who wanted to be here but couldn't be here. And she reminded me, she was watching the recording of our last webinar, which is about social determinants of health. It was a really fantastic webinar. So if you haven't watched that yet, then you can find that on our YouTube page. And she had noticed I mentioned something about mobile health units and wanted to make sure everyone is aware of the mobile health units, the maternal mobile health units that will be around the state this fall. So I have all of the flyers and I just put them in a Google Drive that hopefully, or a Google folder that hopefully you can all access. So I'm putting that in the chat as well. And let me see if I can open up one of these to share with you. I share my screen again. So this is a general flyer that talks about what it'll be and that there will be dates through September and October. They'll be doing blood pressure screenings, mental health screenings. They'll have some lactation support and maternal health education, and public health nurses will be there as well. I noticed Cynthia is here, and I feel like I may have seen another public health nurse on here. I don't know if you want to share any more about your role with these. But and Caitlin Wright is popping on right now. But there's a flyer for every county, it looks like. So take a look at that. Let me know if you cannot open that folder with the flyers in them. I know not everyone has access to Google, but if you're having any trouble with opening that, let me know and I'll see what else I can do. And I have intentions to share that in a newsletter here as well. Cindy, I see you're unmuted. Are you wanting to share something?
Yeah, I was just going to say, so my name is Cynthia Grass. I'm the public health nursing supervisor for Maine CDC in District 6 and 7. And we will be at all of these events. So we have, let me see, we'll be in Greenville, Millinocket, down east, a couple of places as well. And I know that we've already done a couple and there's more to come. Mostly in rural areas are the areas that we're really targeting, and we're really excited to be part of this and see where this goes.
Yeah. Great, thank you. Any other updates or questions for folks here? Any particular challenges you're having in your work that your colleagues here might be able to help you with? Any sort of trends you're seeing that you want to pick each other's brains about? Robin, yeah, go ahead.
It's really short notice, but here in Ellsworth, there's a WIC baby shower from 10 to 12 at the Moore Community Center in Ellsworth. So a lot of us will be there, and Tamara Wilson and Kristen Hayward have organized that. We have a milk depot in Ellsworth, which is where women who are screened by the milk bank can bring their donations. And my first donor is going to be wrapping up. It's been about a year, and I want to do something special for her. And usually, like, I take pictures of her and her kids, and I say thank you on the website, but maybe I'll give her flowers or something like that. So if you have some clever idea that does not involve plastic tchotchkes, I would like to do something to honor her for being our first in a whole year of donating. So I take your suggestions. I did write an article and it ended up just being a blog on my website, but it didn't get into the Ellsworth American or Mount Desert Islander, but that's okay. And anyhow, so that was great. She donated. I mean, we've had over almost 2,000 ounces of milk donated. So that's pretty awesome.
That's so great, Robin. Yeah,
Yeah.
I love hearing about that and the just the power of having a depot. And can you share a little bit more about what the lift is for you to be kind of hosting a depot?
Oh yeah, it's pretty straightforward. All the screening has to be done through the milk bank. There's no cost to the woman. There is a blood test, and that needs to be done. And we can do that at Anchored Women's House. It's all very convenient for her. But she gets all their supplies from the milk bank, and then she pumps and she writes the date and how many ounces it is and freezes it, and then brings it all to me. I meet her, and she signs something that says, "Nope, I and no, I'm sick. That's about it." And this is the earliest date and the latest date of my pumping. I usually figure that out for her because I have to go through and count them all. But anyhow, and then she drops it off and I say, yay, and I take pictures of her and her kids, and then she goes to work and daycare. And I count it out. I count out how many ounces it is. I check the date, see which is the oldest, which is the newest, and then I pack it all up and I call PeriShip and they come and pick it up. And I keep a record of her donor number and when she donated. And I keep a record of the temperature of the freezer every day, well, except weekends. And those are the things that the milk bank wants to know. It's none of it is very difficult. It's just being organized and keeping a tally of who's there and what's the temperature. So it's pretty cool. But the thing is, like tomorrow at the baby shower, people will say, I didn't know you could do that. So I want people to know that donor milk is an option. I also want people to know that the milk bank's priority is babies in the NICU. So sometimes a mom is running low on milk and she's got a 9-month-old. I'm like, I'm sorry, the donor milk doesn't go for that. But if she has a newborn who's not feeding well and she needs a bridge for 2 days or something, then the milk bank can give her milk. I don't dispense milk. I have a milk depot, which means I just accept it and then I ship it off. That's all.
Mhm.
But it's cool.
Thanks, Robin, for sharing more about that. I don't know if you see Brittany's idea in the chat.
Um,
That's cute.
uh, breast macarons at a depot.
Mhm.
Oh, I'm not sure how I would do that though, because I don't have access to the breast milk. I mean, I can't take it from her. So maybe I'll make little breast-shaped macarons.
That's
Okay, thank you very much. That's a good idea.
yeah. Awesome. Thanks. Kim.
Hey there. I didn't have any questions, but I wanted to share like some exciting news about Maine families statewide is that we've gotten a grant to cover all of our clients for free with the mental health app called Mama. So MAMMHA. And it was piloted first in our Portland offices, and Portland shared that they were able to connect parents with postpartum mood disorders in 2 to 4 days with a virtual provider because they have access to a nationwide amount of providers. And so it's individual therapy, it's group therapy, it's a huge database of articles. And all they have to do when they sign up is indicate that they're a Maine Families client and they have access to all of it for free. I believe it also includes case management and med management.
Yeah, yeah, it's great.
So it's super exciting, especially in a time of losing funds to have a new fund.
Yeah, really. That's awesome.
So I've had quite a few clients be extremely excited, and I barely finished talking about it, and they're like signing up on their phone because they've been on a wait list for therapy for like 4 months or more.
Yeah, that's great.
I have a question. I just saw that Maine Family Planning had like $2 million cut and they appealed it and then it was not reinstated. So all the things that they do at Maine Family Planning in here in Ellsworth, Mama is one of them, but I just wonder how that, if anyone knows how's that going. Yeah. The Downey's Community Partners just cut their home visiting program. So we're trying to piece who can do what. I'm really glad to hear about Maine Families, that you're part of that too. So if anybody knows about the funding, that'd be
And
interesting.
I don't know with 100% certainty, but I heard a rumor that maybe WIC is also going to have access to the Mama grant, but I don't know for sure about that. I might be sharing inaccurate info.
No, it does. The WIC in Ellsworth does have that mama program, and we
Okay.
have cards and we send them out to people. But WIC in Ellsworth is also part of Maine Family Planning. So, man, I don't know what's going on with that.
Yeah.
Katie, I don't know if you happen to have any insight on the funding cuts.
I don't have more on that, especially related to me and family planning at this time. Um, I'm sure folks have heard the news and seen the result of the initial lawsuit, but yeah.
And if I haven't shared it in like this environment before, um, like our team for Penobscot Piscataquis, like which is like the greater Bangor area, um, we also have funding to purchase the Enjoy prenatal education. So we can share the app and the booklets with families for free, and we can go through, and it's a whole wonderful like short video database. Um, it has lots of articles. You can get as nerdy as you want, like depending on like your attention span. Um, so we have a couple of different goodies for prenatal and postpartum.
Yeah, that's awesome. That's what Maine Med used for a lot of their classes too, and their patient education. And it's really, I don't know why that link is so long, but it's really quality information, quality materials. That's exciting. Has anyone else come across any really helpful links or handouts or anything that or resources in general that you feel like we should all know about? Or any research you've come across? I'll share a reminder too about our support group list. It is another Google sheet. And if you I need to follow up actually with someone about updating this. But if you see something that needs to be added or changed, then I should probably change the address on here to have them contact me or us. But we're hoping that this will be continue to be a useful resource for parents who are looking for support groups. Yeah. Any other questions or thoughts? All right. Robin?
How is the World Breastfeeding Week publicity going?
That was a great question that I meant to ask everyone, how you all celebrated World Breastfeeding Week and National Breastfeeding Month. I'll admit we didn't do as much as we usually do or would like to do throughout August for that because we've been pretty occupied with conference planning and other activities. But did anyone do anything special for World Breastfeeding Week? We
So
tried to share. Go ahead.
Kim and I made some little myths to bust a myth and put them on Instagram. I noticed that the World Health Organization was doing the same thing. What a great idea.
Yeah. Yeah, Robin, if you haven't been seeing those, and I'm not always seeing everything, check in with Lucy, who is our social media person who does such a great job. Um, yeah, and the other weekly and monthly observances, you can find out more on usbreastfeeding.org. And what else is coming up? I think we're still in um, workplace support, workplace lactation support week. So it's a great time to remember all of the resources that we have. And September is also National Preparedness Month and Infant and Young Child Feeding and Emergencies Month. So there are some great resources on the US breastfeeding website too about that. Check those out. All right. Yeah, I'm happy to give you all 10 minutes back in your day. Thank you, Kim, for sharing. If you haven't seen this already, we have a merch store with some great designs that Kim and others have worked on. So check that out if you're looking for something fun to put on a sticker on your water bottle or a t-shirt to wear. Um, and yeah, do some shopping in the next 10 minutes of your day. Yeah, awesome. Kim's wearing an awesome, awesome shirt. Sweet. Well, I hope to see some of you at the conference or at our next webinar or next meeting or anywhere in between. And thank you so much for taking time to be here today. Have a good rest of your day.